Good morning or good afternoon, everyone. My name is Michelle Barkey, and I am the Senior Legal Counsel at Medcom Benefit Solutions, and has been doing the Affordable Care Act since its real inception when it came out around 2010. And we've always gone back and looked at the Affordable Care Act since that time. This year starts our 6th year of reporting. And for those who do not know, there was an extension granted the week before last, and the forms are due to the individuals now, to the employees who were applicable large employers now on March the 2nd. The deadlines remain the same to file with the IRS. But what we have found over the years is that we've all gotten deep and down and dirty with a lot of craziness with the ACA, but we've forgotten some of the basics. So I think it's time to go back to the basics. And for those of you who might be new applicable large employers or who might become next year, this will give you a little bit of an idea about the Affordable Care Act. We're going to talk about different key points today. First of all, the ACA, what it is, an introduction, what minimum essential coverage is. That's often very confusing. IRS reporting forms, responsibilities of ALEs, applicable codes. Well, let's see if we can get the coding right, because that's where all the penalty issues come from. And we're going to talk about the 1095Cs and the 1094s when we talk about the actually getting the coding right. And then we'll talk just briefly about failure to file and failure to furnish penalties if you don't timely file your forms. There's hard to believe, as I said earlier, that we actually have 6 years of ACA. And basically, the ACA was composed of 3 things as far as we were concerned. One was the individual mandate, the employer mandate, and then the subsidies that they would get at the marketplace. So again, what happened in the past, and when we first started to create the Affordable Care Act, they had to create those state and federal exchanges where people could actually get insurance if they were not offered coverage through their employers. We had to increase the age of coverage for children up to the age of 26. We eliminated those pre-existing condition clauses. Now, on the group side, that also meant that we did not have to get forms of creditable coverage. Back in the 90s, if you had moved from one company and you had insurance with that company, and then you went to the next company, if you had a letter of credible coverage from your first carrier, from the first company, then when you moved to the next company, you didn't have a pre-existing condition. They were completely waived because you had coverage all along. But that credible coverage never translated if you got individual coverage and not coverage through your employer. So then now with the Affordable Care Act, they eliminated all pre-existing conditions. They were prohibited the insurance carriers from canceling or rescinding coverage, except for the case of fraud. And then also, if you didn't pay your premiums, you could also then rescind the coverage or go back until the premium due date. And then, but you had to give adequate notice, and that's the other thing. And then we had a state-based review of the premiums. We had those PCORI fees, where we were charging carriers so much money for the PCORI fees. And then we had an emphasis on prevention and wellness. Prevention was to be paid at 100%. And they hoped that with prevention, we would not have as many devastating illnesses as we do, and that would help keep the costs down. What did not happen that they expected to happen with the Affordable Care Act? One of the premises was that all the states would expand their Medicaid programs so that anyone under 133% of the federal poverty guidelines would be eligible for Medicaid if they did not have insurance coverage, and that was anyone who earned less than 133% of the federal poverty guidelines. That did not happen, and there was a Supreme Court case that said the federal government could not force the states to expand their Medicaid program. And then the Cadillac tax, which we talked about for years, has actually now been abandoned in favor of continuing PCORI fees for the next 10 years. So the PCORI fees were supposed to go away. We still have them, and the Cadillac tax has now been completely abandoned. So let's talk about the history of reporting and an ACA introduction. The ACA was actually passed in 2010, but as always, it takes a little while to gear it up and to get it going. The first thing that came up was the individual mandate that said that all individuals with all, American citizens with few exceptions had to have coverage or else they would face a penalty. And that mandate went into effect in 2014. And contrary to popular belief, it is still in effect. The only thing that happened was that penalty was reduced to zero with the advent of the Tax Cut and Jobs Act in 2017. And that became effective, the reduction to zero in 2019. And then we have the employer mandate, where all applicable large employers with 50 or more full-time, including those full-time equivalent employees that you got from counting the hours of your part-timers, had to offer coverage to 95% of their full-time employees or face a penalty. ACA reporting, because the individual mandate went into effect in 2014, the marketplace and the private carriers who might have given out individual coverage actually had to report in 2014. And they do that on a 1095A, but typically it was just the marketplace that was reporting in 2014 in the 2015 tax year. That 1095A that the marketplace gives also talks about the subsidies and how much money people were getting from the subsidies. Applicable large employers, again, those with 50 or more full-time employees, including full-time equivalents, started to report in 2016 for the 2015 tax year. And providers for that individual mandate use the 1095B, and then they also use the 1094B. And those are for your fully insured carriers that now have to let the government know which coverage they offered, or who took the coverage that was offered to them. And applicable large employers have to report on a 1095C, and then the global form is that 1094C. And each year so far, that filing deadline has been extended. The first couple of years, both the filing, the furnishing to the employees and the filing deadline was extended. The last few years, we've only had the extension to give the forms to the employees, but the filing deadlines have remained the same. I wasn't expecting that to happen this year, but once COVID hit, I thought that the IRS would probably do so, and they did as of last week or the week before. And you must file before the deadlines, or you are going to potentially face penalties. And the IRS is getting very aggressive with the failure to file and failure to furnish penalties. It's easy hanging fruit for them, and they believe that that's where their next cash cow is going to be. Now, again, with the individual mandate, we indicated that most Americans had to have insurance, and they got that insurance typically through the marketplace. And in the marketplace, they had to offer essential health benefits. And what did essential health benefits mean? They had the plans who post on the marketplace have to cover these 16 different areas in order to be able to post. And it is also considered minimum essential coverage, which we will talk about when we get to minimum essential coverage. Failure to have that penalty, that insurance resulted in a penalty. Unfortunately, the penalty was very, very low. So a lot of people decided that, hey, I'm just going to take the penalty rather than take the insurance, but that will cost me a whole lot more. But as I indicated with the Tax Cut and Jobs Act, that was reduced to zero. Now, the marketplace, as we indicated, reports on that 1095A. There is no 1095B. It's the only series that does not have a B form. Now, privately purchased and fully insured health plans report on the 1095B, and that is to show who has coverage to satisfy that individual mandate. And self-funded ALEs complete Part 3 on Form 1095C, which mimics a 1095B form, but it's just included so that you only have to file one form. Self-funded non-applicable large employers, those small self-funded groups, will still use the 1095B form as a private insurer will. Now, one of the things they said about the private insurers as of 2019, when the penalty was reduced to 0, so last filing year was the first filing year for that, is they indicated that the insurance carriers, not the self-funded health plans, even if you were small, but the insurance carriers could take an option of either providing the 1095B to the employee or posting online that upon request, the employee could come and get the form, but it had to be very, very conspicuous, and there was a few additives to that. But employers were never, ever, ever given that option, and that question comes up occasionally. So just know, if you are an employer, you still have to complete Part 3 if you're self-funded, and if you're an employer, you still have to complete the 1095B. So just know that that is out there. But again, we do want to make sure that people are aware of these different forms. Now, the employer mandate, and this is where it gets fun. The employers must offer coverage to 95% of their full-time employees, or face what we call the 4980H penalty, the A penalty, the sledgehammer penalty, where you are penalized on every one of your full-time employees minus the first 30, regardless if you offered some of them coverage. And it's triggered if one individual, one employee goes to the marketplace and gets a subsidy. The next thing that says is you must offer minimum essential coverage. And we're going to talk about what that minimum essential coverage is. If you did that, and you offered minimum essential coverage to 95% of your full-time employees, the next two criteria was it must be affordable and it must meet minimum actuarial value. Minimum actuarial value basically meant that for if you had a bronze plan, which was the lowest plan that met minimum actuarial value, 60% of basically of the dollars coming in went to pay for the health care that employees actually used. So again, the plan had to be a fairly rich plan. And you must complete forms 1095C and 1094 and furnish it to the employees and file it with the IRS timely. And with all three of these forms, the 1095A, the 1095B, and the 1095C, the IRS is able to determine all those things that they wanted to know. Number one, did the individual have coverage? Number two, did the employer offer coverage under the employer mandate to their full-time employees? And was it affordable, and did it meet minimum actual value? And three, whether all those subsidies that are given at the marketplace, were they legit subsidies? Because they're not if the employer offered a plan and the individual went to the marketplace. So with those three types of forms, the IRS got more information than they have ever had before on what we're doing. So what is minimum essential coverage? I don't know if any of you realize, but minimum essential coverage is basically very, very simple. It is where the plan is offered from. So for an example, if it's an employer offered coverage, with very few exceptions, just by the bare fact that it was offered by the employer makes it minimum essential coverage. The government programs, Medicare, Medicaid, also minimum essential coverage at that source. The healthcare marketplace, automatically minimum essential coverage. And, you know, quite often people confuse minimum essential coverage with a MEC or a skinny plan. So when anybody ever calls me and said, yeah, we offered a MEC plan last year, I always need to know whether it was minimum essential coverage that might have met minimum actuarial value, or was it a MEC skinny plan that did not meet minimum actuarial value, and they were potentially facing a penalty. So whenever you look at minimum essential coverage, you look at the source. And if it comes from the employer, the government, the health plan, the marketplace, then that is automatically minimum essential coverage. Except, there's always a couple of exceptions. That healthcare plan that the employer offers cannot be a standalone dental or vision plan, and it cannot be a limited indemnity plan. And what do I mean by a limited indemnity plan? It would be very clearly indicated on the plan. It is typically an individual plan and not a group plan, and it just reimburses so much. It'll say, okay, we'll give you $200 if you go into the hospital per day, but it's not based on the treatment. It's based on what you do, and it's very, very limited. So that does not meet minimum essential coverage. It doesn't even meet the criteria for being a skinny plan. So just make sure that when you look at those indemnity plans, if you're ever tempted to, that just know that you would be facing the A penalty if that was offered. So the IRS reporting, again, as we indicated, the IRS wants to make sure the employer mandate is satisfied. Now, even though there's no penalties on the individual mandate still is out there. So they still want to identify those individuals that actually do have coverage. And we want to make sure that they don't get inappropriate subsidies at the marketplace. If you keep these three goals in mind, when you look at the forms become very, very clear. So there are two laws under the ACA that relate to reporting, and one is 6055 and one is 6056. And 6056 basically states that all applicable large employers must accurately and timely file a report on the coverage offered to the employees. That's it. You have to offer what coverage you offered, not what they took, but what you offered. And then under 6055, every person who provides minimum essential coverage to an individual must report on the coverage they provided. So that's your 1095Bs that the insurance carriers give on a fully insured group. And that is part C on the 1095C if you're a self-funded group. You're a self-funded group, you're reporting under two statutes, the ALE statute for what coverage did you offer, and the 6055 statute as to who actually took the coverage. Now the reporting forms, I think these look familiar to most of you, but they tell the IRS a whole lot of information. The first information is just the employee information, and then it also is the applicable large employer information on the 1095C, and that's all in part one. You must make sure that all that information is accurate and complete. And this is the form that you would also furnish to the employee and then give to the IRS through the filing. Part two is the key. Lines 14, 15, and 16. By code, they let the IRS know whether or not you satisfied the requirements of offering coverage to 95% of your full-time employees, and also whether or not that coverage met minimum actuarial value and whether that coverage was affordable. When I talk about MEC, again, minimum essential coverage, not only does it have to come from the employer to make it minimum essential coverage, but one other criteria has to be made. You have to offer it both to the employee and the dependents. If you don't offer it to the dependents, then you've got an issue. If you don't offer it to the spouse, you're good to go. But you do have to offer it to the dependents. And part three mimics the 1095B, and it is only for self-insured groups. And you would check off and you would fill out the name and the birth date and the social security number of each individual who actually took the coverage, and then the months for which they took the coverage. The date of birth is actually only filled out if you don't have a social security number, which you might not have for a newly born dependent or a newly adopted dependent, but you have to make a good faith effort to get all those socials. Now the 1094C form is the transmittal form. And again, this transmittal form is very, very, very important. It also gives the IRS an eye glance at how big you are, what you're doing, and whether or not you met the coverage. Part one is, again, just all the information about your company, where you're located. And it also gives the IRS a name and a telephone number in which they can contact you if they have any questions. But again, this is like your W-3. This is your go-to form. Now, an ALE needs to timely and accurately file these forms. We are getting so many penalty letters now because employers did not file timely. One of the things that when you do give those files to the employees, finishing them to the employees, even if you're self-funded, you don't have to give them to all the dependents. You give them to the employee and you assume that the employee gave it to the dependent, unless a divorced spouse comes up to you and asks you for a copy. But typically, you just have to give it to the employee and you've satisfied your obligation. Now, again, when we're talking about what's on that 1095-C, part 1 is just all the demographic information of the, this is on the employee, is all the demographic information. But then on line 14, this is the offer of coverage. This is the most important, one of the 2 most important rows on that 1095-C. It's in part 2. It gives you a box to say whether or not the same code would be used for the whole 12 calendar months, then you would complete that. Otherwise, if there's any variety throughout the year, you would code month by month by month. But at the end of the day, you have to have January to December outlined, and you would have for each FTE, and you would have to make sure that the government actually understands what you did each month. Now, the codes, I just want to go through them very quickly because I think most of you understand them, but just in case there's something that you do not. 1A is the qualified offer method. This means that you offered coverage to 95% of the full-time employees, and you not only offered it to the employees, but you also offered it to the spouse and the dependents. And the affordability on this code is going to be based on the federal poverty guidelines. So it could not be more than 9.5% of the indexed amount for that year of the federal poverty guidelines. If you use the rate of pay or the W-2 method, you cannot use the qualifying offer method and put 1A. What does this do for you? Basically, it means you don't have to complete line 15 and you don't have to complete line 16 for the times that you use code 1A. Because the government will say, okay, they did it under the federal poverty guidelines, and we know that everybody was offered coverage. Medcom took the position right from the get-go that we didn't like using code 1A because we think it could be an audit waiting to happen someday, that the IRS will come back and say, prove that you did offer coverage to the employee, spouse, and the dependent, and that it was under the federal poverty guidelines, because they don't have the information. They're just assuming that you're completing it properly. So we always said that if you use the federal poverty guidelines and you offered it to the employee, spouse, and the dependent, flaunt it. Use the code and let them know that you did such a great job. 1B, that you offered the coverage only to the employee. If you did that, you were going to face a penalty because you did not offer minimum essential coverage to 95% of the full-time employees and the dependents. So if you use code 1B, you're facing a penalty. Code 1C, minimum essential, and you're going to face the A penalty if you have one employee that went to the marketplace because you did not offer to dependents. 1C, you offered it to the employee and the dependents, but not to the spouse. You're good to go. There's no penalty there. You don't have to offer to the spouse. 1D, you offered the employee, and but you did not offer to the spouse, and you didn't offer to the dependents. Going to run into a penalty here because you offer to the spouse but not the dependents. Going to run into a penalty here, the A penalty, because you have to offer to the dependents but not the spouse. 1E, which is the qualifying offer method, you offered it to the employee, spouse, and the dependent. And if you did 1A, you could use 1E and then fill out box 15 and 16 and let them flaunt what you did, that you did such a great job. 1F, this is a penalty in the waiting. 1F is that you offered coverage to 95% of your full-time employees. You might have offered it to the employee, spouse, and dependent, but it did not meet the minimum actuarial value. It was one of those skinny plans. It was not an indemnity plan. It met the minimum essential coverage offering, but it did not meet that minimum actuarial value. When you code that, you don't code line 15 or 16 because the government already knows if anybody goes to the marketplace, you're going to face a B penalty on that, which is only for the individuals who went to the marketplace and got a subsidy. 1G, this is you're offering coverage to somebody who's not a full-time employee for any of the months. But you have to use this only for all 12 months. You cannot use it during the year. It has to be for all 12 months. So when would you use this? Well, you've got somebody on COBRA, and they've been on COBRA for all 12 months this month because they left work the year before. So if you can use it for all 12 months, great, you use it. Or what if you offered coverage all year to a couple of part-time employees? They're not full-time employees. For any month of the year, you can use the code 1G. Or what if you're one of those employers who have 2% shareholders and you've offered them coverage even on a post-tax basis? You could put those down as 1G. What that 1G code in that 12-month box tells the IRS is there is no penalty for this employee, whether or not you offered coverage, whether it was affordable or anything else. And you only do this typically if you have a self-funded health plan and you're also reporting in box 3 the months that they actually took the penalty, the coverage. Otherwise, you're never going to have a situation where you usually use 1G. 1H, there's no offer of coverage. You didn't offer this person coverage for that month. And it could be because the person wasn't an employee that month, but 1H is no offer of coverage. And then 1J, we began to see this in the 3rd year because you could conditionally offer coverage to spouse, which means that you could offer her coverage at a higher rate, or you could say to the spouse, we're only offering you coverage if you do not have coverage through your own employer. So that was when the minimum value was offered to the employee and the spouse on a conditional basis, but not the employee, not the dependent. So if you did this and you code 1J, that's a penalty in the making. And then 1K is when you offered it conditionally to the spouse and you also offered it to the dependent. So this one you will not get a penalty, but if you did 1J, you are going to get a penalty. And then for this coming up year, we're going to have some more codes because INHRAs are now available. And INHRA is an individual coverage HRA with a whole lot of rules attached to it. But the government has come up with more codes, 1L, 1M, and 1N for employee-only coverage for the 1L, employee independent coverage but not spouse for the 1M, and then the employee, spouse, independent is 1N. So just know that you're going to see these new codes. They're only if you offered an independent coverage HRA, and if you did or not, that depends. But these codes are only used if you use the employee residence where the employee lives as your safe harbor. And then we've got other codes if you use the employer location for your affordability safe harbor. And that's 1O, 1P, and 1Q. So just know that you're going to see those on the information sheets this year, and that's what's coming down the pike, but only for the individual coverage HRA. Now, line 15, that is where you put the premium amount that the employee has to pay, not total employee the amount, but the contribution that the employee would have to pay for single coverage only in the lowest cost plan that met minimum actuarial value. So it might not be what the employee is actually paying because he might have a spouse or dependents on there, and he might have chosen a higher rated plan, but it's the lowest cost plan for which the employee is entitled, for which the employee can take coverage. But you don't code line 15. If the codes you used previously was 1B, employee offered only, 1D, 1E, You do code this if you got 1B, 1C, 1D, 1E, 1J, or 1K. Anything else, you do not put the coverage amount on it. And then you enter on line 15, as I said, the lowest cost amount. If no amount, you're still required to put 0.00, and if the amount's the same for all 12 months, you can use the all 12-month. Line 16, the government tells you very clearly you don't have to fill this out, and a lot of people took them at their word. Files will go through without a line 16 being filed, but in that time you are going to get a penalty because these are your explanations. On line 16, if you offer coverage and the person waived the coverage, this is where you tell the IRS that we did offer coverage, employee, spouse, independent, for an example, 1E, but they waived the coverage. And then you use your appropriate safe harbor. 2G, if it's you use the federal poverty guidelines, i.e. if you do not want to use that 1A code, you would put 2G. 2H if you're using the rate of pay method, and 2F if you're using the W-2 method. And again, if the code is the same for the whole 12 months, just use the all 12-month box. The codes, 2A, the employee was not an employee. So the only code that matches up with that is 1H. I did not offer the employee coverage because he was not an employee. So 1H, 2A, that matches up. Doesn't usually match up any other way. 2B, you can use that if it's not a full-time employee for any given month, or you can use that if at the end of he quits during the month, and you offered him partial benefits for the partial month, but your plan says that coverage terminates at the day they leave the company, then the code would be for that much. I did not offer coverage for the full month. Why? 2B, and it shows the IRS that he quit during that month. And then they would expect to see 1H and 2A for the rest of the calendar year, or until somebody, if he gets rehired. 2C is your friend. 2C means the individual took the coverage, and you're not going to have them go to the marketplace. So you always love it when you get a 2C. 2D is when somebody's in a limited non-assessment period. So the day they start work, if coverage doesn't start the day they start work, or even if it does, but you haven't paid the whole month because they started midway through the month, 2D is your starting code. And then if they're in a limited non-assessment period, which means they're in a waiting period, or they're in a limited non-assessment period, you use 2D. The caveat that the IRS says on the coding forms is that you can only use 2D, or you can only claim a non-assessment period if you offer benefits the first day of the month in which they would be qualified. So for an example, the first of the 14th month, if you're a new employee and you're in a limited non-assessment period for the first time, or you don't go beyond 90 days, or whatever your waiting period is. There could be some legal challenges to this because it was not in the actual regs. It just seems to be on the IRS forms. So I would certainly, if you get any penalties for that period of time, take a look at it. And then 2E is only for multi-employer interim guidance. This is your unions when you don't get the information from the union as to who was offered coverage. As long as you contributed to the union benefit, you just have a safe harbor, 1H2E, and that takes care of all your union people. So unions are very easy to code. And again, we talked about the safe harbors, the 2F, 2G, and 2H for your affordability safe harbors. Now, part 3 is the covered individuals. Again, it's only if you are a self-funded group and you're indicating that and this is for the individual mandate, where who took the coverage under the individual mandate. Now, you do have to enter the name and social of each person. You have to make a good faith effort to get that social at least once every year and to verify it once every year. So you can do it at the enrollment time when you actually do enrollment. Now, 1094C is kind of the W3 of the 1095s, but it gives you a lot more information. It gives the IRS a whole lot of information about you. Part 1 is basically all the filing information, the address, etc., where and the telephone number of contact information. So that's something that you do. Line 7 and 8, as I say, is that contacts persons and thing. 9 to 16 is if you're a designated government entity. I can almost assure you that you're not a designated government entity filing on behalf of the employer. Most government employees never designated themselves as a designated government entity because then they have to also take all liability for that. Line 18 is very important. It's how many 1095Cs are you submitting totally to this with this 1095 with the 1094. Now 19 is the authoritative transmittal. You know, you might be an employer that says, okay, I'm going to do so many today and send it out, so many tomorrow and send it out. Never recommended, but some do. And at the very end of the day, though, you've got to add it all up together and only do one authoritative transmittal and saying this is the total count. The IRS only wants to look at one authoritative transmittal, and they want to know what your total count is. Now, the one authoritative transmittal is for each employer. So if you're in a control group, each of your control group members have to do their own authoritative transmittal. So even though it's only one per employer, each of the members of the aggregate group do their own. So basically what I always tell people is look at your EINs. Each EIN has to do their own filings. Lines 20 to 22 are for I'm not quite sure what this is. Parts 3 and 4 should not be complete. Oh, for an authoritative transmittal for the employer. You would never do an authoritative transmittal, complete that if it's not the authoritative transmittal. You only complete it once you get the actual authoritative transmittal. Line 21 is the line that you would check off if you are an aggregate group. If you're not an aggregate group at all throughout the year, you would not check that. But if you have any ALE members and you're an aggregate group or a control group for any months of the year, you would complete that. And then there's another place where you actually list your members, your other teammates, your other EINs that you're associated with, and the months that you're actually together. Line 22 is the line that I want to talk about. The first year it had a whole lot of information on it. This year and past years, it only has 2 things: the qualified offer method, which is that 1A method. If you use that and you put 1A, then you can say you used the qualified offer method, and you would check that A box on line 22. The other box they have is the 98% method. And this means if you offered 98% of everyone in your company coverage, you can take off that you can check off that 98% box. It's everyone in your company. It's not just your full-time employees. It's everyone who is employed, regardless of whether they're full-time or part-time. I think that's an accident waiting to happen. Now, what does that advantage give to you? Well, on the third part of the form, this part of the form, you don't have to complete the total employee count. Or the full-time employee count, you would just complete the total employee count because you're telling the IRS that you offered coverage to everybody. That's an accident waiting to happen. We've seen it many time and time again where somebody says, hey, but I offered coverage to my full-time employees, but you're not telling the IRS who your full-time employees if you use that method. So we always want to make sure that that 98% method rule, I would much rather you took the time, said who your full-time employees are and who your total employees are. Now, this also tells you the minimum essential coverage indicator. Did you offer coverage to 95% of your full-time employees, plus their dependents, the children, up to age 26? If you can say yes, then you will not be facing a penalty. Then you give your full-time employee count. The full-time employee count are your full-time employees who are benefit eligible or would be benefit eligible if you offered coverage. So they're the ones that have already gone through a waiting period. They're the ones that have already gone through a measurement period. If they hadn't gone through a measurement period, or they were still in a measurement period, or they were still in a waiting period for that month, they are not considered a full-time employee. This is the box where you're going to be penalized based on how many full-time employees you have. You tell the IRS you have 50 full-time employees and you did not offer them coverage, you're going to be penalized on the 50 minus the first 30, because you always get to take off 30. So it's really important that you get that box right. The next box is your total employee count. You take all your full-time employees plus all your part-time employees, everybody together, and you say, this is my total employee count. On the back end, Medcom, when we get a client that requests that we do the reporting for them, we take a look at that. We make sure the full-time employee count has equal to or less employees than the total employee count, because the total employee count should equal the full-time employee or have more. And we also get to use that to determine and to look at it and say, maybe this one's not an applicable large employer, and then we can actually go back and ask the client if they are an applicable large employer and do some work there. It happened a lot in the first years. People are getting a little bit better at that. And then if you're an aggregate group, if you have any other EINs that you are associated with, you would check the box and say for what months you are associated with them. Now, and we've just covered all that. Now, if you do not file timely, there are penalties for failure to file, and there are penalties for failure to furnish. Failure to file means you did not give the IRS the forms in the proper time frame. You did not tell them timely that, these are the coverages I offered. Typically, do it at the end of March of each year if you file electronically. If you don't do it by then, you get penalized so much money. It was $280, I think, last year. If you get it before August 1st, it goes down to $100. But anything after that, you are going to be looking at much more penalty. You're going to be looking at that $280. We have seen appeal letters come in that have sometimes been over $1 million for just failure to file and failure to furnish, so depending on the size of your company. So you always want to do this timely. And the deadlines next year, it was extended to furnish to the individuals to March the 2nd, but you still have to file on time with the IRS, which I believe is March 31st, unless there was unless that falls on a Sunday, and I don't believe it does. Failure to furnish the employee statement, that's another $280. So if you didn't file, the IRS also assumes that you did not furnish, and you're going to be penalized on both of those. Now, if you did not file, the IRS pretty well can figure out with your W-2s if they believe that you're an applicable large employer. So how do they penalize you this $280 if you don't tell them how many full-time employees you have because you never filed the information with them? They're just going to go with the straight W-2 count. So if you had 600 W-2s, they're going to say, okay, you owe us 600 times 280 because you filed 600 W-2s. Now you said, wait a minute, I've got some people that worked 1 month, some people that only worked for 4 months, they weren't full-time employees. Well, you're going to have to sort that all out when you deal with the IRS as far as the appeals is concerned. And it is a long drawn out process for appealing. Much better to do the files at the onset. Now, one of the things that the IRS is doing is they were a little lax the first couple of years if people were late filing. They did, take a lot of excuses, but now they're not taking excuses anymore. In June of this year, the Treasury Inspector General for the taxpayer advocate, who is also responsible for informing Congress as to how the IRS is doing in all aspects of the IRS, actually evaluated the filings. They actually evaluated the coding. They actually evaluated the whole employer shared responsibility gizmo that the IRS has put together. And they came back and they said the IRS has done a terrible job, and they want the IRS to collect more penalties because they said they're leaving a lot on the table. So failure to file and failure to furnish is the low-hanging fruit. The IRS has already had their hands slapped, and they are getting tough. And basically what the IRS says, okay, the only excuses for reasonable cause are events beyond the filer's control. Tell us what happened that you could not file on time because it was beyond your control. Well, you know, some people in Louisiana right now, they've just been hit with 2 hurricanes, and systems might have crashed. They might have an excuse that, you know, this is way beyond our control. Our business is still trying to get back up and running. We thought we had all this information, but that broke over here. So they might have an excuse, but just think, what does it mean to be beyond your control? It doesn't mean that you didn't know about it. It doesn't mean that you didn't realize you had to do that. This is something that is beyond your control. The second one is significant mitigating factors. Well, what is mitigating? I mean, the IRS is not taking, gee, I didn't know I had to file, or gee, I thought, you know, somebody else was filing for me. They're not accepting those excuses anymore. So we've got to make sure we get the filing done. They're a little bit more easy to deal with if this is your first year of filing and you were late. They take that into consideration. So if this is the first year that you were an active large employer and you were trying to offer benefits and you were trying to get it all together, they may be a little bit more forgiving. And then there is a due diligence safe harbor. This is, I did everything. I did everything I could possibly do, but at the end of the day, something happened with my ability to transmit it to the IRS. And then I called the IRS and I did everything I could to see if I could get this through. And the IRS told me, okay, you know, we're working on an issue, and they worked with me. And then finally, 10 days later, I got it through. Due diligence is also hard to prove because you've had to do a lot of work to get to due diligence. So what I'm telling you is make sure you have a filing plan in place. And because we're getting a lot of penalty notices, and because a lot of it has to do with the basics of coding and everything else, make sure you get the coding right. Certain codes are just, as I say, the IRS can just take a look at it and say penalty, like 1F, I didn't offer minimum actuarial value. You might have, but you coded it wrong. The IRS is going to take that 1F and fly with it and then send you penalty letters. And you spend a whole lot more money appealing than getting it right the first time. So Medcom actually does do ACA filing, and we've been doing it since the beginning of time, since the ACA came out. And we have been very, very successful at it. I was very pleased. Myself and Derek Ashton put it together the first year and had a lot of good support from a lot of people. And we actually got it right the first year. We figured out those codes. We were constantly on the phone with the IRS, asking for clarification on certain things, but we got it right. But in order to make sure that we can reach our deadlines, we always, as all other vendors, have to give a due date. And if we don't have a signed proposal by that time, we cannot guarantee that things will be out on a timely basis, and it will be put to the end of the box after everything else has gone through, and you could be facing penalties for being late. And our deadline, just to let you know, is November the 15th of 2020. So at that stage of the game, I just want to see if anybody has any questions. And we are going to be giving you a copy of this presentation as well as a recording next week. And that will come out. So let me see if we've got any questions here. And the question is, last year was our first year of reporting electronically with the ACA. Previously, we had a company file for us. Our files were accepted with mistakes. How do we find out what those mistakes are, and do we need to refile with corrections? The IRS, when it does tell you that there are mistakes, it usually gives you the lines of the mistakes, and you can pretty well tell what the mistakes actually are. The IRS has different types of errors. They have errors that the file just blows out altogether, it's not accepted. And then they say, you know, it is accepted, but with errors. I will tell you a lot of the errors relate around the TIN numbers and the Social Security numbers. And a lot of the times those can't be corrected. The IRS, and we found that out the first year we'd come up, and it was usually for the dependents, the children, and we would verify the children's Social Security cards, and we were right, but the IRS might have a different number there, and the systems will never match. But yeah, it does give you some hints with the corrections and what needs to be corrected based on what you get back. But I can certainly, I see who you are, and I'll certainly get with my ACA department, and they have a lot more information on what they see. And she should be able to, I'll get them to send you a quick email as to what they actually see and how they go about determining what the actual errors are. And with that, I think that that's the only question that we have at this point. So I want to thank you all for attending today. And again, just double check your coding, make sure you get the forms out correctly, and make sure you get them out on time, because you're going to save yourself a whole lot of grief if you do that. And again, you know, sometimes we just have to think of the basics. And the number one thing is always think what the IRS is trying to accomplish. They want to see if we as employers had met our obligation under the employer mandate, whether we offered coverage to 95% of our full-time employees, and whether or not that coverage that we offered met minimum actuarial value and was affordable. Next, they want to know who had coverage in the United States. It's always a very important question to our government to know how many uninsureds we had. So they want to know it from the marketplace. They want to know it from the fully insured carriers, but they also want to know it from the self-funded health plans. And that's why it's important that we provide that information to the IRS if you're self-funded in Part 3, or the carriers will do that for us. And that gives the government a good idea as how many people are actually insured. And again, these are all mandates that are still alive and well. I know you've heard that the ACA is under review at the Supreme Court, and it is. They're doing oral arguments in November. But when they do the oral arguments on November the 11th, the decision will not come out until the end of June, or the end of June typically. This is a major case, and major cases are usually released the last week that the court is in session, and then there's usually a whole lot of stuff going out. And the Supreme Court shuts down for the summer, the end of June. And then it doesn't reopen until October, the first Monday in October. So they've just reopened. They will hear oral arguments. The ACA is alive and well as far as everything is concerned now. The question before the court is if the individual mandate was reduced to 0, the penalty, is it a tax? And if it is not a tax, can the rest of the ACA survive without the individual mandate? Could they still have the employer mandate? Could they still do pre-existing conditions? Could they still charge us for COI fees, even if the individual mandate went away? So that's the argument before the Supreme Court. But again, it's business as usual, and we won't find their decision. I guesstimate, and I'll take a bet with anybody for a small amount. No, I don't think it'll be out until next November, till next June, the end of next June. So with that, thank you all for attending. And for the one person that asked the question, I'll get with my ACA department, and they who handle this on a day-to-day basis, and they will be able to give you some hints as to how to determine what you need to do. So thank you all for attending, and I appreciate it very much. Thank you. Bye.